The problem is with the insurance industry and the insurance companies. It's a profit mechanism. So this video is about insurance companies versus government-run healthcare. They both suck because my dad is in the insurance industry. He left because he got tired of ripping off the people he was selling to. We are paying a high deductible, getting low cost, paying the majority out of your own pocket, getting very little benefit for what you pay, because there wasn't enough people in the program to lower the cost. And people buy into it because the cost was high. There's no way to do it. All insurance companies were charging a lot of money, and all the insurance companies stayed the status quo. No one would lower the price. They couldn't sit there and handle it because none of the people were in the system. They also had the prescription drug companies they're paying for to help push the drugs and pharmaceutical companies and prescription drugs. So there is no way to bring it down because you're pedal pushing. You are pedal pushing the drugs. So you're not going to be able to sit there and have cheap health care because they're pedal pushing drugs. They're doing everything they can. That's a cost venture. So it's going to make things expensive. Now, I get it. It's not a conservative bill. It's not a free market. It's just a watered-down Obamacare. So, that is why he is right. Ron Paul is right. It is Obamacare light. And light means it's just a worse version of Obamacare. So it's a little better, but it's still Obamacare. It's just not as good or as bad as Obamacare. And so that is what it is. It's light, which means it's, less bad. But it's still bad. But you know why I wasn't upset about it yesterday? Because it doesn't matter. The fact of the matter is, free market system is not any better. All Obamacare is exacerbating and making it worse and just, timesing it and making it even worse than the free market. So it just exacerbates and just puts it on steroids. But the fact of the matter is, a free market system is a version of Obamacare. It's just even a lighter light of Obamacare. The free market is money-driven, profit-driven. So the free market system is just as bad. It's just less bad. It's just as bad in regards to people having to pay an arm and a leg to get it with no coverage. And the prices are high. It's just not as high, but it's still pretty bad. So I guess I shouldn't say just as bad, but it is bad. And that's just the way it is. And so degrees really don't matter. It's still terrible. And there were some people that said, I can't afford that. Some can, but they have to pay an arm and a leg. Less people didn't have it on Obamacare, because Obamacare made you buy it, or you'd have the penalties. So you have to pay a penalty if you chose not to. So at the end of the day, I got news for you. As bad as Obamacare is, and it is, and it's worse. But if you send it back to the free market and this, you can eliminate the issues and the problems of the free market system that it has with the money and the drug companies and the insurance companies and the bed with the pharmaceutical companies and drug companies. And they charge so much for prescriptions. And when you go to the doctor, they give you this. And they push this on you, push that on you. Then you go to the pharmacy at CVS or Walgreens or Target or Publix in the grocery store that's down here. And then you're sitting there going there and you're like, whoa, why is this so expensive? Because that's what it is, man. It's not cheap at all. It's expensive. Everything's expensive. The only real difference between Obamacare and the free market system is the free market system is less expensive. Meaning that people will be able to buy it that couldn't buy the government system. But it still doesn't mean it's cheap by any stretch. It's still way expensive. It's just cheap enough to where if they mortgage something off, or if they, don't cut this out or cut that out and then turn it towards this, they can afford it. Versus Obamacare, if they did do that, they still couldn't afford it. It's just, this one's just right, but still heavily expensive and still dragging them down and still costing them a pretty penny to have it. My dad saying there like, this is not right. It's just too damn high that, none people would buy into it. So then the people that did want to, they're paying too much money. And it's unfair because the young people didn't want to get into it because they weren't healthy. They weren't sick, they were healthy and didn't need it. So now it's just good for everyone else. Now they're going to have to pay it later on then because they don't cover business and conditions. We're screwed doubly. And then we're going to eat the cost because they're not going to turn anyone away except for surgeries and a few other things. Most everything, doctors will still see you and still take care of you. Who's going to pay for it? Government's going to end up paying for it anyways. They're bankrupting the government just to cover what they don't have. I don't have the money. Oh, well, go to the emergency room. They'll see you. They even see illegals right now, too, for the fact. I mean, illegals cross the border to get care. Oh, well, we'll take them. We'll see them. We don't turn illegals over. Mexicans, people crossing the border, wherever they come from, country they come from. Oh, yeah, they're still going to get seen. They get taken care of, and it's going to cost a pretty penny. That's right, pretty penny. And then who's going to pay for that? They're not paying for it. We'll see them, whether they got the money or not. And that's going to continue to drive the cost up at the hospitals. Whether it's insurance that goes up or not, the hospitals sure will, and the bills you pay there is going to go skyrocket. And then you end up paying more money for it. And then the insurance companies will cover less of it, and then you have to pay more out of your pocket as the cost keeps going up. And, I got some news for you, man. The insurance companies are covering less and less, and then as the cost keeps going up, you're paying more and more and more. It's just the cost of the game. So, I'm telling you, man, it's getting outrageous, man. This has been one night in the hospital room, one ambulance ride, and even pills that they give you because you can't get to a pharmacy. They charge you an arm and a leg just to take one pill there, or two pills, however many you need to take. I mean, are you kidding me, man? And then all this stuff, I mean, you're looking at going bankrupt. You're looking at over $1,000, man. Just a one night. And then the ambulance ride, man, that is probably $1,000 to $2,000 a ride. You're cheaper just to ride an Uber. Go on Uber. Hey, Uber, come and take me to the hospital. Don't bend my neck that way, man. I need to keep my head drained. Or whatever direction you need to be. Don't do it. Don't do it. You need to just keep me angled like this so I don't cut off my circulation. Can you take me to the hospital? Can you take me to the hospital? I mean, this is crazy. This is asinine. These costs are so crazy. These are out of control costs. And who pays for it? Insurance companies, unless they can make money, they're going to charge most of it still on you. And whatever you pay is still going to be shit feed. That's the reason why I didn't get too upset yesterday. I agree with Mark Levin that it's a sham and it's a crappy bill. I agree with Sean Hannity it's a crappy bill. Unfortunately, if you have a good bill, it's still crappy because the free market system isn't better. It's just that this isn't in free market, though, not even close. And it is Obamacare light. And I would take Cruz. If you guys want to say about the free market, if you want to be free market care, even though that's way not that much better than Obamacare, then this is not even close to doing that. So you're right, this isn't doing what you wanted to do. But with that being said, it's not way good either. Because the conservative way, it's way not that much better. It's way corrupt and falling its own way too. Because people can afford this. And they can afford to keep doing this. And it's going to crumble right underneath on its own weight. Because of lack of people under there to hold it up. Because people aren't buying into it. So this is still messed up too. I don't even really care. Because I said to Mark Levin in the Twitter feed yesterday, that they both suck. These both suck. One sucks less than the other, which is a free market system. It's the best of the worst. But it's shitty too. It's the thing my dad's not in it anymore. When I think I lost my freaking house, man, then I couldn't graduate the rent. I think I don't have my house I love so much. Because it fell, and the weight fell underneath him. And he had to get every time was leaving the state. He had no one to cover his people. Plus, when he was covering him and when he did cover it for time left, it's like, oh my God, he was ripping people off with the, high deductible and little coverage. He got out of it because he was sick of ripping people off. And then the next time leaving, my dad couldn't afford anything anymore. He got out of it, and then we weren't making the money anymore, the 6-7 figures, so he couldn't afford the house in Overhill no more. This was crappy. This is bull crap. It's not. It shouldn't be made to make a profit. I mean, yes, my dad needs to make money to cover compensation for the work he does, but it shouldn't be profit-driven. It should just be a byproduct you get because of it. It's like people that, they shouldn't work to work. They should work to live, not work to work. Now, you may need to work, but that still doesn't mean that's why you do it, though. Work is just a byproduct. You don't live to work. You live to live. You just have to work. But that's not why you do it. It's like, yes, you need to make money, but that's not why or what you're doing, though. You're not doing it to make money. You just need to make the money as a byproduct for the work that you put into their care and to sign them up and stuff. And it's compensation. But it shouldn't be money driven. Money driven, profit driven should not be in there. You know? I mean, yes, you still should make money, but not because of profit, but because of compensation for giving them insurance. But yes, you will get paid, rightfully so, for what you do. But it shouldn't be, but the insurance shouldn't be based on that. And the coverage shouldn't be based on that. It should be profit driven of the cost of the insurance. It should just be as a byproduct you get paid, but that should be completely separate than from the cost of the insurance. And it should be based on what you make, though, and based on quotas and based on profit. And it's bullcrap. And I'm telling you, until that changes, the insurance companies suck too. And I'm sorry, but my dad got out of that business because it's corrupt, it's stupid, and I don't like it. And what they do, some of those people do, is just disgusting. And the way they rob people just to make money, they rob from some people, you know, they just rob their employees just so they can make a profit too. They only rob their own men too, in some cases I've seen. They're greedy insurance companies to make a profit. So I ain't gonna defend them. I don't give a crap. Some even do rob their men because, you know, they want to make a profit for the insurance and make some money. So they're gonna make a profit even if some of the men have to take less money. See, that's bullcrap too. My dad worked for someone that wanted him to do that. He couldn't do that, so he left them too. Went for his own independent company, Insurance Investment Concept. But then that went belly up again, like I said, because the insurance went belly up. The insurance is crap. And our state commissioner didn't do anything to reel it in. So it's pretty crappy too. So I ain't going to sit there and get all bent out of shape. Yes, Levin and Glenn and Sean Hannity and Ben Shapiro and Bill Kristol and all these people are technically right. And Ron Paul and all these people. And Ted Cruz, you name it. But at the end of the day, the insurance company's not that much better. So it really is not really that big of a difference. I mean, it is more than splitting hairs, but it still doesn't mean it's that much better though either. And so to me, it's like, yes, technically on principle, Levin is right. And all you see I just mentioned is right. But at the end of the day, insurance still sucks. At the end of the day, if you send it back to the free market, it's not that much better. Really, the only thing you can do at this point is if you're making a decent amount of money, or at least enough so you can put some money aside each month, just put it in your own savings account with your bank that you're hooked up with. Bank of America, Wells Fargo, Florida National, whatever your bank is, PNC Bank, whatever it is, Wachovia, whatever it is, Achivia, whatever, and just put your money in and save it in the bank, because that's really all you can do at this point. And be your own savings, save your own money, and pay it out of your own pocket, because right now, it all is gone to hell. And even the system that Ted Cruz wants, like I said, I've just been explaining to you for the last 13 minutes, it sucks too. So to me, Ted Cruz's solution isn't the answer. The reason I'm agreeing with Ted Cruz is not that it's the answer or the solution, but that it's based on facts. And on this, whether it's the answer, solution or not, he's right. This isn't that. This is Obamacare light. And if you guys are wanting free market, this is not even close to that. I still think this is terrible too, free market. So my dad's not in it anymore, and it's terrible, and the coverage sucks. But at least it'll be what you want. You want to turn the free market, as bad as that is. You want the free market to run it, and even if that's running into round two, so be it. At least the free market, since that's what they're supporting, and that's what they're for, they have to sit there and back it. But the fact of the matter is, it sucks, and it's terrible too. Everyone's like, oh, free market, we're free market Republicans, we're free market conservatives. Doesn't matter if it works or not, we're free markets. Well, fine, be free market. Doesn't mean it works. But you know what? At least if it falls in the free markets, and that's what you support. But hey, if it fails, it fails. At least it's in the free market. That's what we support. We're conservatives. We're principles, and we're for the government to get out of our lives and to not get into our lives and to manipulate or to be protectionist and to pick winners and losers to the healthcare industry is wrong too. Even if, when you stay out of it, the picking is not very good either, because the care sucks. But it don't matter. It all sucks. But At the end of the day, you're going to do what you're going to do. We all know it. We all know it. And you're just going to let the insurance fall flat in its face too, good or bad. And there's not enough good that will rise out of the bad, but oh well. That's all I had to say on this. They both suck, and Free Market sucks less. I guess it's lesser of the suckies, but they're both terrible.